New at 6, police officers and mental health professionals are working in tandem to provide resources to people in crisis rather than give them a ride to jail. Knoxville's co-responder program with the Helen Ross McNabb Center and the police department has expanded over the last 4 years.
Supporters love it, and they say this is just a start. 10 News reporter Olivia Degg joining us now with more on those responder teams and the number of calls they respond to. Olivia, they average almost 2 a day.
John Robin, they responded to 900 calls last year alone, but only 4 of them ended in arrests. And the goal is to support people struggling with mental health crisis and substance abuse issues. They tell me it's about responding with training, knowledge, and compassion. When someone in Knoxville is having a crisis, a co-responder team hopes to provide resources, not an arrest.
This program was born out of passion.
In 2020, a partnership began where mental health professionals and police take calls side by side. Knoxville's program was the first in the state.
Because we cover, the entire city, from Sequoia Hills to the Mission to Holston Hills.
Police officers like Seth Blaine with crisis intervention training work on the safety side.
We get assigned those calls that used to just get sent to patrol, the people who are suicidal, people who are psychotic, people who are off their medication, people who are hearing voices.
That support is paired with mental health expertise from the McNabb Center.
The clinician is doing a crisis assessment with that individual and helping with de-escalation. And we are tailoring our resources to that client.
Leaders say on average, responding to a call takes an hour.
Before we had co-response was, our officers were, not able to spend the amount of time that was required.
But after the call, there is still support.
People are so used to seeing us when they are in crisis, so when we show up when everything is okay, it's just a whole different dynamic.
Leaders say the connection, communication, and compassion is providing real results.
Over the last 5 years, I think that it is so important to see that relationship we've built and the trust that we've built with each other to be able to help that person in crisis and get them connected to appropriate services.
Right now, there are 6 co-response teams. They're hoping to expand the program to double that, 12. But there's even more officers trained in critical response training, or crisis intervention training, excuse me. And recently, they've been taking that training to places like Indianapolis and West Virginia, sharing what they've learned with more law enforcement agencies nationwide.
We'll continue to follow the story. Olivia Degg with the update.